Hello, I'm Karen Parry, Manager of Information Services at the East Brunswick Public Library. I'm here today to talk about a very unusual and exciting program that we have on Zoom called Let's Talk About Oncology and Hematology Disease-Related Anxiety. This is a program that's being co-sponsored by the East Brunswick Public Library and Asterra Cancer Care here in East Brunswick. I'm joined today by Neshama Marcus. She is the Director of Social Work at Asterra Cancer Care. Welcome, Neshama. We're so happy to have you, and we're so excited to hear about social work and oncology. Now, why did you come up with that title?
Sure. The reason why we came up with anxiety is because anxiety is universal. We all have it. We all feel anxious. Anxiety is just our brain's way of telling us that there's stress. We're going to be talking about most common symptoms, triggers, and how to identify all that early on. While our focus will be on cancer and disease-related anxiety, because there are nuances, the information is going to be relatable.
So Neshama, what are some types of anxiety or concerns that people going through cancer treatment are dealing with on a daily basis?
As a social worker, I'm not always brought into the room right away. I'm typically brought into an exam room when a patient presents with anxiety-related symptoms, particularly excessive worry, to the point where they can't hear or process what their provider is telling them. The most common types of anxiety that I see is fear of the future, brooding or worrying about the past, and also the fear of losing control. But anxiety presents in all different types of ways. It can present more in like the emotional sphere with the irritability or the constant crying. And it can also present more physiologically with like sleeplessness or lack of appetite or difficulty concentrating.
I'm sure a lot of our viewers would like to know, what does a social worker do at an oncology office?
So I can't speak to all oncology practices, but I typically lump social work at Asterra Cancer Care into 3 buckets. So the first bucket I call case management. It's social worker as case manager. And what that means is they help patients navigate community resources, how to apply for government benefits, how to apply for disability, for example, and also things like home care. So that's case management. The second bucket I call mental health. That includes individual psychotherapy, group psychotherapy, family sessions, and the intention is to support a patient's mental health as they're navigating their oncology process or journey. Not everyone discloses right away to their oncologist or any of their providers that they have mental health issues. So the way that we access that information is by doing mental health screenings in our office. And that allows us to pick up on those patients that go under the radar normally. The third bucket I call programming. It's educational sessions or wellness programs that address the patient as a whole. As a patient, what do I need to know in order to progress in my journey?
That is so interesting, Neshama. How can seeking the services of a social worker help people to stay mentally healthy and strong during cancer treatment?
Sure. So patients often tell me that they feel total loss of control over their bodies when they have a disease, whether it's a non-malignant hematology disorder or cancer. Sometimes they feel forsaken by their bodies, or they feel that their bodies are retaliating against them. And sometimes treatments might not always go exactly as planned or exactly the way that they had envisioned, because no matter how communicative their provider is, there's so much information being thrown at them. So speaking with a social worker can help them better manage their anxiety and that fear of the unknown throughout that process.
And Neshama, who is this program for? Just patients or also their family members?
If it was up to me, I'd say everybody. While I hope patients tune in because I think it's super important for them to understand what resources are available to them, I think it's just as important for family members and family caregivers to understand and hear those nuances of how anxiety affects patients and what they can do to better support their loved ones.
That is so interesting, Neshama, and I'm really looking forward to this program. This is the first time the library has ever done a program like this where we've worked with a social worker and we are trying to broaden our health resources to the community through our program. So we are so excited about this program. I want to remind all of our viewers that it will take place by Zoom. It's called Let's Talk About Oncology and Hematology Disease-Related Anxiety, and you can go to our library website at ebpl.org, click on the calendar, and there will be a link to join the program. So again, thank you so much, Neshama.
Thank you so much for having me.
We are honored to have you present at our library with your expertise and knowledge.
Thank you.